A hearty good evening and welcome to the session on the process of egg sperm embryo freezing. We are glad to have Dr. Ankush Raut among us today to help us understand the topic. He will take us through that and more in this session today. Doctor, you have the stage.
Oh, thank you. Thanks a lot. So today I will take you through a very important topic of embryo freezing and oocyte freezing, when we should do it and what is the importance of doing it. So now the world is changing every day. Similarly, there are advances in the IVF which are also happening every day. There are many couples who tends to marry late in their life, and once the age increases, the chances of their pregnancy also decreases. For any female, 20 to 30 years is considered as the best age of having pregnancy, because in 20 to 30, number of eggs and the quality of eggs both are good. After 30, the number of egg goes on decreasing, as well as the quality of eggs are also go on decreasing. So after 35, number drops again. After 40, the chances of pregnancy drops down to less than 10%. So because of this age effect, many times couple is face difficulty in conception when they plan for pregnancy late in their life. In all such a couple, embryo freezing or oocyte freezing can be a better option. Suppose if you are a married couple, married in let's say 2 to 3 years, your wife's age is in between 25 to 30 years, and you want to plan a pregnancy when after 5 to 6 years, that is once your wife turned 35 and you get settled into the career. In all such couples, oocyte freezing can be a very good option, because oocyte freezing or embryo freezing can be a very good option, because this oocyte freezing and embryo freezing will help us in many ways. First of all, it helps us to overcome the problem of decrease in a chances of decrease in a percentage of implantation, or the decrease in a chances of pregnancy after 40 or after 35, because as we are retrieving these eggs at an earlier age, their potential to give the pregnancy will remain same. So it means that even at the age of 35, if you are having your oocytes frozen before the age of 30, then they still have a chances of pregnancy similar to what your colleague at the age of 30, or what you had at the age of 30. Suppose if you freeze the embryo before the age of 30, the chances of pregnancy remain same when you transfer embryo even after the age of 35. Similarly, in some couples or in some women, there may be a problems like
Hello guys, sorry to interrupt, but doctor has some issues with the network, so he'll be joining shortly. Please hang on.
Hello everyone, I am Dr. Ankush Raut. Today we are going to discuss about the egg freezing. What are the importance of egg freezing? In which condition we should do egg freezing? That is, we should consider the egg freezing, and what complications we can expect during the process of egg freezing. So, egg freezing is also known as a mature oocyte cryopreservation. Is a method used to save women's ability to get pregnant in the future. Egg harvested from your ovaries are frozen, unfertilized, and stored for the later use. A frozen egg can be thawed, combined with the sperm in a lab, and implanted in the uterus in the future. Now, this is the technical definition of oocyte freezing. I will explain you in a very simple words. Oocyte freezing is a procedure where your eggs are retrieved from your ovary, and those good mature eggs are frozen in our laboratory for their use in the future. So why it is done? Why there is a need to freeze these eggs in the laboratory? There are many conditions. Suppose there are a condition in which you want to postpone your fertility. Suppose if your age is in between 20 to 30 years and you want to have a pregnancy after 35 years of your age. And as you all know, 20 to 30 is considered as the best age of having pregnancy. After 30, the number of eggs decreases as well as the quality of eggs also decreases. As the number decreases, quality decreases, naturally your chances of pregnancy also decreases. But if you freeze your eggs before the age of 30, then your chances of pregnancy will remain same even if you use those eggs after the age of 40. Sometimes some women may need a treatment for the cancer. As we all know, in the cancer, we use different types of medicines like chemotoxic medicine, sometimes radiotherapy, chemotherapy. All this radiotherapy and chemotherapy can actually affect your ovary, and it affects its potential to produce a good eggs, its number as well as the quality. So what we can do before actually starting a treatment for a cancer, we can retrieve your eggs from the ovary and we can freeze those eggs so as to use them in the future. And this way, we can actually preserve your fertility even when you are having a cancer. Because if you freeze the oocytes before starting a treatment for cancer, then your treatment for the cancer will not affect your fertility potential. Many female face a problem of sterility where it is where the chances of pregnancy is almost equal to zero after undergoing a treatment for the cancer like chemotherapy or the radiotherapy. Sometimes a couple, let's say in 20 to 30, may wish to have a plan of pregnancy after they get established in the career. And this is one of the very most common indication nowadays. Young couples come in between 20 to 30 years age group, and they want to know about how they go for the planning of pregnancy if they want to have a child after the 35. We know after 35 the chances of having Down syndrome, Edwards syndrome, and Patau syndrome, all these genetic abnormality increases. But if we make the embryos before the age of 30, and if we store them and if we use them even after the age of 40, the chances of having genetic abnormality will be very, very, very less, almost equal to a couple whose age in between 20 to 30. So if you make the embryos at an earlier stage, it will also decreases the chances of having genetically abnormal baby in the future, even if you try to go for the pregnancy after the age of 40. So these are some of the indication I told you, which in which we can freeze the eggs or we can freeze the oocytes. Now, what are the complications which we can expect during the procedure of oocyte freezing or the embryo freezing? As we all know, in order to freeze the oocytes, I need to have oocytes in the laboratory. So naturally, what I am going to do, I will stimulate, I will give you some injections to you, I will give you hormonal injections to you every day, and almost for 10 to 12 days, starting from the second day of your periods, we will also monitor the growth of all the follicles in the with the help of sonography, and once they are mature, we will retrieve the follicle in the laboratory with the help of sonography and a small needle. Now the question is now whether this procedure is complicated. So now this procedure is super simplified. Even the injections which you will be having are very, very easy to take, and they are having a very, very less pain. So, and also during the retrieval, you don't have to undergo anything like having an incision or laparoscopy or any big surgery. It is just like drawing a blood for testing a blood sample, testing for some blood reports. So in that way, we usually aspirate the eggs from your ovary with the help of sonography. So there is no cut, there is no stitches, there is no bleeding during the whole procedure of retrieval of the eggs. So whether it is safe, yes, it is completely safe. Definitely, there are some complications which may associated with anesthesia, which can be associated with any other procedure also. But overall, this procedure is very safe. There is no cut, there is no stitches, there is no bleeding. Many times, patients think that this procedure may cause increase in the weight, but this is a myth, because during the procedure, sometimes ovary gets bulged and we ask you to stop the exercise and everything. So naturally, your weight may increase by 1.5 kg, but as you start doing the exercise, that weight also decreases. There is one more thing that you always concern about is whether there is an increasing in the risk of cancer if I undergo ovarian hyperstimulation in order to freeze the eggs. So absolutely no. Definitely there is no added risk of having a ovarian cancer if we do one cycle of ovarian stimulation to have the eggs in the laboratory. Secondly, there can be minor complications like sometimes distension in the abdomen, sometimes and mild or moderate ovarian hyperstimulation syndrome, but all these complications are not life-threatening and we can manage them very well. So overall, oocyte freezing is a very simple procedure. It is completely safe procedure, and it will also ensures the good chances of a pregnancy even when you want to have a pregnancy after the age of 35 or 40 if you do it before the age of 30. So now when to do it, the best time to do it as early as possible before the age of 30, naturally after 20. Now, how to prepare yourself for doing or oocyte freezing? First of all, whenever you come to the center, we try to we evaluate you, we take your history, and we try to understand for what purpose you want to freeze your oocytes or want to freeze your embryo. So, after discussing, after taking a history, we decide whether to go for the embryo freezing or whether to go for the egg freezing. If the partner is there, if both partner agrees, then we try to go for embryo freezing. But if your partner is not decided and you just want to do a oocyte freezing so as to use them after the age of 35 when your partner get finalized, in that condition we just go for the oocyte freezing. So after doing a history round, taking all the necessary investigations and everything, we do one very important test that is called as sonography, which will tell us about the condition of your ovary, the number of follicles present in the ovary, number of eggs present in the ovary. It will also tell us about whether there is any cyst or endometrium or any other pathology associated with the ovary. Apart from that, some blood investigations are very important. These are thyroid stimulating hormone, prolactin, and the AMH. After doing all these investigations, we also screen you for the infectious diseases, like for the presence of hepatitis B, hepatitis C, syphilis, and the definitely HIV. After doing this infectious disease screening, we will ask you to come on the second day of period in order to start the ovarian stimulation. As I said, ovarian stimulation involves the hormonal medications, which we will start from the second day of periods after doing a sonography. The injections we will give you for approximately 10 days. After giving 5 to 7 injections, I will ask you to come for the follicular monitoring. We will do a sonography. We will monitor the development of follicles, and once they are ready to retrieve, I will ask you to come to the center early in the morning. Come to the center around 8 to 9 a.m. in the morning. You need to come fasting. We will give you a small sedation or a small short general anesthesia, so that you should not have a pain of a retrieval. And then with the help of sonography, we will aspirate the follicular fluid in order to find the egg inside them. The procedure hardly takes 10 to 15 minutes, but sometimes it may take half an hour also, depending on how many number of follicles you are having. Once I retrieve all this follicular fluid and the eggs, we hand over this fluid to the embryologist, where they screen for the presence of oocyte or presence of egg in them. Once they find the egg, they inform us. We will inform you. If you want, we will also show you how your eggs looks like. So they are sometimes circular, sometimes oval also. And then we count the number of mature eggs and we freeze those mature egg in the laboratory. Now the question comes, sir, for how many years we can freeze those eggs? So those eggs can be frozen for maximum 10 years, but it all depends on till what time you want to freeze them. So after procedure, we will ask you to stay in the hospital for approximately 2 to 3 hours. We will monitor your pulse, BP, respiratory rate. We'll also see for if there is any pain. And if everything is normal, we'll discharge you in next 3 to 4 hours. And from next day, you can start working again. Definitely, sometimes you may feel a pain, sometimes fever can be there. So if you have that pain or fever, then also you can just call to the center and come to the hospital. We will manage that. So the procedure is simple, although delicate procedure, where we retrieve the eggs, we screen for the good eggs, and we freeze them. So in short, oocyte freezing or embryo freezing is a novel procedure. It's a very good procedure, especially for the couples who want to postpone their pregnancy, or for the woman, or for the or for the woman or the couple who is undergoing a treatment for cancer, chemotherapy, or the radiotherapy. In all such cases, oocyte freezing and embryo freezing can keep their chances of pregnancy even at the age of 35 or 40 if they do a timely freezing of these oocytes and embryo. Thank you all.